For decades, the niacin flush has been portrayed almost universally as a bothersome or even dangerous side effect. The intense skin warmth, redness, and tingling many people experience shortly after taking standard-release niacin. This reaction is one of the main reasons patients struggle with adherence in high-dose niacin therapy for cholesterol, leading to widespread use of flush-free or extended-release forms. But if we look beyond discomfort, the flush tells a richer story about niacin's pharmacology and potential benefits. Mechanistically, the flush occurs because niacin binds to the G-protein-coupled receptor GPR109A on dermal Langerhans cells and adipocytes, triggering a cascade of prostaglandin D2, PGD2, and E2, PGE2, release. These prostaglandins then cause vasodilation of capillaries, leading to the familiar warmth and redness. Far from being an allergic or toxic reaction, this is a controlled, reversible process, and it reveals that niacin has successfully engaged a receptor linked to profound metabolic and vascular effects. The therapeutic implications are striking. GPR109A activation has been shown in both animal models and human studies to suppress inflammation by reducing pro-inflammatory cytokine production. In the context of atherosclerosis, this anti-inflammatory effect may contribute as much as niacin's LDL-lowering properties to its cardiovascular benefits. Moreover, the vasodilation associated with the flush increases microvascular blood flow, potentially enhancing nutrient delivery and oxygenation to peripheral tissues. There's even intriguing evidence that regular niacin-induced prostaglandin activity can improve endothelial function, a critical factor in preventing cardiovascular events. So instead of seeing the flush purely as a negative, it can be reframed as a biomarker of effective GPR109A activation, confirming that niacin is not just being absorbed, but engaging the pathways known to lower cardiovascular risk. Indeed, in older clinical trials where flushing was common because they used immediate-release niacin, the benefits on heart attack reduction were robust. Some experts have hypothesized that newer extended-release or flush-free formulations, which avoid or greatly reduce flushing by limiting peak plasma levels or bypassing GPR109A, might compromise these protective mechanisms, though this remains a matter of debate. On the other side, NR and NMN, while excellent for raising NAD, do not activate GPR109A and therefore do not cause flushing. This absence of vasodilatory prostaglandin signaling might seem convenient. After all, who likes a bright red face? But it could actually represent a missed opportunity for cardiovascular and anti-inflammatory benefits. Without GPR109A activation, NR and NMN may lack some of niacin's unique advantages beyond NAD replenishment, especially for systemic vascular health. Of course, not everyone tolerates the flush well, and for many patients, the discomfort is enough to outweigh benefits, especially if it reduces adherence to therapy. But the solution isn't to universally avoid the flush at all costs. Strategies like starting with low doses, taking niacin with food, or using extended-release formulations that preserve some GPR109A activity without excessive liver toxicity risk can help harness the benefits while minimizing distress. Ultimately, instead of treating the flush as an unfortunate nuisance, recognizing it as a therapeutic biomarker of active prostaglandin-mediated vasodilation and GPR109A engagement offers a more sophisticated perspective. The lack of flush with NR and NMN isn't inherently an advantage. It simply reflects a different mechanism, which may forego some of the unique, clinically proven cardiovascular protections niacin provides. In the broader landscape of NAD precursors, this highlights niacin's dual role. It doesn't just raise NAD, but also activates powerful anti-inflammatory and vasodilatory pathways, with the flush serving as visible proof of this engagement.